My second vascular case study is on tortuous vessels. Tortuous arteries and veins are commonly observed in humans and animals. While mild tortuosity is asymptomatic, severe tortuosity can lead to ischemic attacks in distal organs. Clinical observations have linked tortuous arteries and veins with aging, arteriosclerosis, hypertension, genetic defects, and diabetes. Tortuous vessels can be curved, kinked, looped, or spiral in appearance. Here are a few images of what tortuous vessels will look like throughout radiology. A 70-year-old female presents with arterial degenerative disease and reduced wall thickness in her carotid artery. She claims to have episode of dizziness, vertigo, and persistent tinnitus, or ringing in her ears. Sonographic imaging provided proof of a tortuous internal carotid artery. Here are different images of normal ICA findings through ultrasound. The PSV should be between 45 and 125 centimeters per second on an internal carotid artery. The waveform of an ICA has a very distinct look. Keep this in mind as we move on to what abnormal ICA findings may look like. Abnormal ICA waveforms are defined as having a peak systolic velocity greater than 125 centimeters per second and an end diastolic velocity less than 140 centimeters per second. They also include a lot of spectral broadening. It's easy to see the curves and loops of these tortuous ICA vessels compared to what we just looked at. Also notice that the waveform is very, very much different than your average ICA waveform. Tortuous vessels are often seen hand in hand with old age and are more likely to happen in females. They can also be caused by hypertension or can be a post-surgery effect. Tortuosity and redundancy of the internal carotid artery is a common finding. In one of the largest angiographic studies conducted by Wiebel and Fields, internal carotid artery tortuosity and angulation, respectively, were observed in 35 or 5% of 1,438 consecutive patients. Extensive clinical studies have shown that artery tortuosity is associated with hypertension, aging, arteriosclerosis, and other pathological changes in the arteries. Here I've placed a graph with predisposing factors including old age, gender, hypertension, and other cardiovascular risks, as well as associated diseases that are linked with arterial tortuosity. Severe tortuosity may lead to arterial kinking, which causes arterial occlusion and is associated with severe symptoms, including transient ischemic attack, stroke, and other cerebrovascular deficiencies. While many mild tortuous arteries are supervised but left untreated, severe tortuous arteries with clinical symptoms can be treated with reconstructive surgeries. Severely tortuous or kinking carotid arteries have often been treated by surgical shortening reconstruction, as demonstrated in the image here. A few weeks following the surgery, a patient will be able to return to his normal daily activities. This 70-year-old female patient presented with dizziness, vertigo, and ringing in her ears. Her history included thin carotid walls and arterial degenerative disease. She was sent for carotid ultrasound and findings showed a tortuous right ICA. Arterial tortuosity is common and is associated with hypertension, aging, and arteriosclerosis. If the tortuous veins are severe, they can lead to an occlusion, which can cause an ischemic attack, stroke, and possibly death. In our patient's case, the tortuous veins were severe enough that the physician chose to perform a shortening reconstruction surgery. Here is an example of a carotid ultrasound protocol. Notice that the common carotid artery, external carotid artery, and internal carotid artery are examined at a proximal, mid, and distal location. Although different facilities may have orders that vary from this protocol, The common carotid artery, bifurcation, internal carotid artery, external carotid artery, and subclavian artery will all be imaged with color and spectral Doppler. Differential diagnosis can include multiple tortuous vessels in the carotid area or buccal arteries. Our patient will need to come in for follow-up ultrasound visits to monitor the reconstruction of her internal carotid artery. After a few weeks, she should be able to return to her normal daily activities with no trouble.